Hi, everyone. Thank you for joining our session on trauma-informed care, honoring veterans, a model for us all, presented by Brandon Beattie and Mary Ann Nogaki Stahovich. We have no disclosures. So I proudly serve as the Director of Didactic Education at the George Washington University PA program. Prior to becoming a PA, I served as a U.S. Army combat medic for almost 6 years and deployed multiple times to combat. Additionally, I'm the co-founder and member of the board of directors for the Society of Veteran Disability Examiner PAs, or SOVDEPA, which is an AAPA special interest group. And I'm actively involved with the George Washington University Veterans Association. And lastly, I'm a lifelong member of the Veteran Caucus, which is an AAPA constituent group.
Hi, I'm Mary Ann Nogaki Stahovich. I'm currently the Director of PA Admissions at California Baptist University in Riverside, California. And I've been working most recently in occupational medicine for about the last 15 years. I've also been a PA for 29 years now. And I have a separate certification as a DOT certified medical examiner. That's the NCRME certification. I'm also a member of the Society of Veterans Disability Examiner PAs group, which is a AAPA special interest group, as well as being a member of the Veterans Caucus, which is, as Brandon had mentioned, an AAPA constituent group.
So by the end of this session, we hope that you'll leave being able to describe the importance of teaching PA students to take a social history, including that military history, defining the patient-centered care, or PCC, for veterans as a teaching model for other patients, defining trauma-informed care, or TIC, discuss examples of veteran inclusivity, and discuss strategies for teaching PA students to ask sensitive questions about military experience. So first off, why are we talking about this? Well, veterans suffer from healthcare disparities, and this is multifactorial. This is related to the socioeconomic status, geographic factors, communication styles, and provider bias. And there remains a significant lack of preparedness for health professionals who work with the veteran patients. And there is this misnomer that veterans receive their care from the Department of Veteran Affairs. And so it's a mentality of, well, they'll train their providers to do this. But the reality is veterans represent 6% of the US population, but 94% of veterans receive care for their chronic healthcare needs outside of the VA system. So as I tell my students, it's not a matter of if you'll see a veteran, it's a matter of when you'll see a veteran clinically. Musculoskeletal injuries account for the leading cause of outpatient medical encounters among active duty Army soldiers. In 2017, this made for 2.2 million visits. And I bring this up because a significant number of soldiers develop chronic pain or long-term disability after their initial injury, which increases the risk for health deficits. But if healthcare providers fail to ask about military service, this creates an unnecessary barrier to treatment. So with that, we're talking about trauma-informed care. So trauma is highly prevalent in the military and veteran population. When you look at the civilian side, roughly 50% of Americans have experienced at least one traumatic event, compared to convenience samples of veterans showing upwards of 90% of veterans having experienced at least one traumatic event, and a large majority having experienced two or more. So failure to provide trauma-informed care can delay mental health treatment as well as other services.
So just to reiterate how critical that trauma-informed care is for veterans, we wanted to share this rather startling statistic that every day 40 to 44 veterans take their own life. We have here it's shown in the graphic 22 to 24 by suicide, 18 to 20 by self-injury. And so we will be sharing some resources closer to the end, take-home tangibles, in the aim of helping to combat this crisis.
So when thinking about how trauma-informed care can help to prevent some of those astonishing statistics from the previous slide, trauma-informed care acknowledges the compounded impact that trauma can have on an individual. And so we here have highlighted 3 themes for you to consider in your own curriculum. First is the basic understanding of trauma. So thinking about things like the behavioral responses, the symptoms, assessment, and treatments. Additionally, working to create an environment of safety for the trauma survivor. And so focusing on things such as privacy, respect, and awareness. And then lastly, adopting a strengths-based approach to services. And so fostering skill building, resiliency, and empowerment. The presence of mental health disorders is the strongest predictor for homelessness in the veteran population. Additionally, another strong risk factor for homelessness is traumatic brain injuries, or TBIs. And these have been called the signature injury of Operation Iraqi Freedom and Operation Enduring Freedom in Afghanistan for those armed conflicts. One study of more than 2,000 veterans from those conflicts found that 10% had a mild or moderate TBI, and 44% met criteria for post-traumatic stress disorder, or PTSD. This is believed to affect up to 300,000 veterans. And unfortunately, TBIs are associated with decreased income and decreased level of social support. And failure to provide that trauma-informed care can delay these mental health treatments for these folks that have these TBIs. One thing to think about with these veteran population is that it's not just men. Females are an often overlooked subsect of the veteran population, and they're projected to continue to increase through 2040. In addition to the same traumas experienced by their male counterparts, female service members are also at an increased risk for sexual assault. And unfortunately, the climate in the military may not allow for open transparency for reporting those things, secondary to concerns for punitive consequences. Because of that, there can be a lack of coordination of care across services for these female veterans. When we think about core principles of trauma-informed care, trauma awareness through training is a hallmark here. And what we're looking to do is an organizational restructuring to incorporate an understanding of trauma at the systems level. And there's an emphasis here on both physical and emotional safety, as well as respecting the patient's choices. And lastly, one of the most important components of this slide, fostering a strengths-based approach. And this is in contrast to a deficits-oriented approach. So here we're focused on skill building and future-oriented goals. Well, now let's talk about some obstacles or barriers for incorporating trauma-informed care into the healthcare arena. One can be a lack of provider awareness, simply not having training such as this presentation. Time can be another issue, certainly with the advent of the electronic medical record and the number of boxes that clinicians are now required to check. Some of the quality of our healthcare can suffer from that. Additionally, there's discomfort with asking about trauma. Some providers are fearful to ask about military trauma due to concerns of triggering that trauma. That said, though, if asked respectfully and explaining why the information helps guide the care, most veterans are certainly happy to explain their military service. Additionally, there can be a lack of knowledge of valid assessment tools, and we've included some of those later in this session.
Great. Another important approach to be aware of is patient-centered care, or PCC, for veterans. We've shared with you already some of the unique characteristics of veterans, which is important to obtain in the history to provide the correct care. And so that definition for veterans really has to do with keeping veterans at the middle and the focus of all that we're doing when we're caring for veterans, and conveying that to the students helps them understand that keeping veterans at the focus. So in other words, with them at the center, it begins with an exploration of their values and goals and vision of their health. And also it means including really building upon the strengths-based approach that Brandon was discussing earlier, which means in focusing on that positive part for healthcare, instead of taking the approach of what's the matter with you, to switch gears and focus, making it more focused around what the patient can do by asking them proactively to share what matters to you to help them engage in the conversation and be more active with their own care. And so along those themes, it is interesting to know that there have been some medical schools and also pharmacy programs that have already incorporated this type of patient-centered care for veterans. So since those medical models have already existed, we wanted to share with you a little bit about what medical and pharmacy schools have done on their end to include a patient-centered care approach for veterans. One of them is called My Life, My Story, or MLMS. That is a veteran-based program that has in-depth interviews where, again, the veteran is at the focus and discusses their own journey and the unique aspects of their journey as a veteran. So this is also helpful to know about because it actually addresses certain patient-centered care competencies, which we know, in fact, can also translate over, as some of these other lessons can, to additional populations who are also at risk and other populations who may also be underserved. So those competencies can include remembering the person and showing focus on them as a whole person, and then also demonstrating good bedside manner with care and compassion. That's really central to the PA profession. And then also making sure that the patient is really at the heart of their attention by truly listening. And then finally, allowing the veteran to explain their whole story, because often it is a complicated journey that they have to share. And so as we move forward, we're excited to share with you a few quotes from a pharmacy program where a veteran had shared some of his thoughts about what he is currently struggling with. So one veteran shared, right now, I can't breathe or walk. I walk with a cane, but I have no regrets. I think I did everything I thought I could accomplish. And what an amazing statement, really, for this veteran to share. And so you can see from this quote and even from another quote, tell anyone who reads this to enjoy life every single day because you don't know what's going to come tomorrow. Really, actually relaying the Carpe Diem, of living out every day to its fullest motto. You can see why these quotes themselves would be very inspiring. And so it's not a surprise that in this study that was done in a pharmacy program, also with students and residents, that over half of those students and residents determined in the end that this was a good use of their time to a great extent. That was over half of the participants that were in this survey. And then there was another third that felt to a large extent as well. So the reception by students and residents has been positive. So we anticipate that it would also be the same for PA students if incorporated, apart from establishing a positive relationship with patients. So we do have here a brief video. And okay,
the video.
we'll move on. That's right. So sorry. So moving on to research and statistics, it's important to know that this information we're sharing today is backed up by evidence and statistics. Part of that starts with recognizing that veterans have unique and very definite healthcare pressing needs. For example, we know that 30%, there was a 30% increase in veterans who enrolled in VA healthcare over the past year. And we know additionally, as one example of a chronic disease that many veterans are coping with, that actually upwards of a fifth to a fourth of all veterans are diagnosed with diabetes, which of course is much higher than in the general population rate. So this is one example where a higher frequency of a chronic disease means that it's all the more critical to have this population's health needs met. And in fact, many veterans also have and meet the criteria for something that's called diabetes distress. Diabetes distress is the inability to cope with the daily tasks of managing diabetes, which can be complicated. And in the case of veterans, it can be further exacerbated and triggering, as Brandon had mentioned, can be the case before, for veterans who have a background of trauma. So the way that TIC and PCC can be included to cover holistic care is by recognizing these potentially triggering events. One example would be from the study that some veterans have pointed out that the ongoing pain with repeated finger sticks within just a given day is an additional exacerbator of their pre-existing pain. And so that's a special consideration for veterans. And then in addition to that, we also wanted to mention that veteran healthcare is also crucial in the way that it can be used to address and meet health disparities. And that is because there is a large group of veterans who are in the minority population. So any work that we do with veterans is more likely to also include minorities as well. And that's because minority veterans make up about 23% of the total veteran population and about 35% of the female veteran population. The minority veterans tend to be younger than white and non-Hispanic veterans as well. And the minority veterans themselves are expected to increase in their numbers by 34% by the year 2040. So we know, therefore, that efforts that we are encouraging now are going to be all the more important as we move forward in time. And so as we continue to think about veterans and how to include them and fold them into medical education, since we have seen that that has been done in medical schools and also pharmacy schools, we want to mention that that precedent is there in multiple studies, which we've included here, and that medical schools themselves have found that obtaining a medical history may not be enough, and that it may not adequately prepare clinicians for caring for the veteran population. So what are some strategies that can be undertaken by PA educators to include a military history? So those could be either student-directed, and those can also be faculty-directed. And one interesting example of this comes from a recent study by Fabrizio et al. And essentially what they did was they were studying PTSD in terms of the medical school model curriculum. And they asked the medical school students how they would rate the activity of using veterans as a standardized patient in learning about PTSD. And the results here over 3 years, while it was a smaller N of 13, the results came out to be 4.8 on a 1 to 5 Likert scale, indicating medical students found it to be quite worthwhile in terms of their time and value to be learning from veterans about PTSD. So as we move into thinking about salient points for how to teach our PA students more about how to take that military history and what that might mean, including specifically the types of best practices, we can remind our students that because the PA education model is built upon a medical model, a medical school model that was condensed, that medical student workshops also can serve us as a precedent and may in fact be a model for us as we may be creating our own workshops around veterans as standardized patients. And we want to encourage our students to think about carefully the unique challenges that veterans have had and the unique needness to provide sensitivity in obtaining the history from a veteran, given that they are quite likely to have had past trauma, perhaps even more than one type of trauma. In addition to that, it's also reasonable to recognize that families of a veteran as well have a unique perspective. And we know from history taking that oftentimes a spouse or a family member may be the crucial advocate or the representative for a patient who is a veteran. And so thinking about their perspective is also valuable. Interestingly enough, this was just very recently explained in a September 24 JAMA article entitled "No One in Charge," where a retired physician had written about her discussion with a retired veteran who was trying to advocate for his wife, and it really was not clear to him who he should reach out to on the team. So it's a reminder about how important IPE is, and that we always want to clarify to patients who the medical team leadership is, no matter who our patient is.
So we wanted to share some real world examples, and so any identifying information has been removed to make this HIPAA compliant. But in my line of work as a disability examiner, I'm a contractor for the Department of Veteran Affairs. I saw a gentleman in his late 40s who was presenting for a veteran disability exam, and he had a history of osteosarcoma of the jaw, status post-surgical resection, and chemotherapy. He was followed by multiple civilian clinicians, and a review of his entire medical record, upwards of 2,000 pages, showed no mention of military service throughout his extensive workup and treatment. But significant past medical history that was missing here is that this patient was deployed to Iraq twice and had multiple exposures to burn pits. And osteosarcoma is a presumed condition under the PACT Act. So the PACT Act is the Promise to Address Comprehensive Toxins Act. And this was passed in 2022. And this is the most substantial piece of legislation impacting veteran healthcare since Abraham Lincoln began the Department of Veteran Affairs. And so being a veteran disability examiner has taught me the power of asking about military service during most, if not healthcare visits. As a veteran myself, I'm shocked by the number of clinicians that I've seen in my lifetime who've never asked me about military service or toxic exposures. And not asking misses key components of the patient history, as was represented by this gentleman.
Yes, and I'd like to share as well, with the names and identities also removed, an example from my own clinic. And that is when I saw a 35-year-old male who came into the urgent care. The chief complaint was listed as being sinusitis. Overall, he was healthy, and yet he was coming in with 5 days of both frontal and maxillary pain, analogous to the gentleman you have depicted here, where the fever, although no dental issues were identified, and the rest of his HE&T review systems was negative. So as I mentioned, he overall was currently healthy. On his own, he mentioned that he had had a nasal fracture about 15 years ago, which he had acquired from being a paratrooper and training at Fort Benning, Georgia, which is known for its paratrooper training. And so in volunteering this information, he also shared with me that he was very susceptible to repeated sinusitis attacks, which only resolved if he was prescribed antibiotics. We're all familiar with how important it is to rigorously clarify who obtains antibiotics. And yet we also know that every patient is unique. And so this was an example of where the patient's military history actually made a difference in terms of what treatment was considered and provided for him for quicker and faster resolution. And it was interesting to me that this patient recognized that this was a salient fact that he had to bring up himself. And it had, even though this had been happening for him again and again regularly, it did make me think that he knew that he might otherwise potentially encounter resistance with being prescribed an antibiotic unless he explained his special circumstance, which certainly is an unusual one, but really important to consider. So we've shared with you how important it is to help the students understand history taking from a veteran. At this point, you may already be considering incorporating veterans, perhaps as standardized patients, whether it be for OSCEs or other similar events. You may also be asking yourself, how could I possibly find veterans for such events? And so here, I wanted to share a very practical example that this may be even easier than you might anticipate, because just about all of the academic universities have a Veterans Center. So finding that resource is really critical. Clearly, asking your veteran students is really a great first place to start if they have any candidates they might like to recommend who would be comfortable with such a possibility. And then also checking in with your Veteran Resource Center director or someone with the equivalent title. In the case here at the California Baptist University in Riverside, California, I reached out to our Veteran Resource Center director, and he is very familiar with the veterans in our undergraduate programs. And in addition to that, he also coordinates special events. So he has outreach with a number of veterans. So just to briefly share how veterans are highlighted at our university as well. Again, you never know, you might be at such a basketball game when veterans are being highlighted. That could also be another resource. But it's also another way to recognize that veterans can be honored at the university at a number of levels. So we just have this brief example on video here.
Honor the 13 lives lost during our country, serving our country. Here to represent for Les Coral Caribbean McCoy is his mother, Shana Chapel, and representing the 12 others are 12 members of Ghost Company. Presenting Kareem's father with a token of our appreciation is Riverside County Supervisor, Kara Spiegel, and presenting Lieutenant Sam Porter of Ghost Company with a token of our appreciation as a Filipino of Blessed Tires. And then at this time, please rise, and we have served or are serving in our nation.
So it's also nice to see that they were honoring all the veterans in the audience that day as well. And so we'll move along here.
So in terms of implementing both trauma-informed care and patient-centered care in your curriculum, incorporating a veteran-centered content is win-win for our students and our nation's heroes. And PA educators may wish to include various components into sessions and workshops, thinking about things like unconscious bias, healthcare disparities, barriers to care, and as Marianne mentioned, these standardized patients. And students must practice asking these sensitive questions of veterans, no different than other aspects of how the clinical visit is practiced. For instance, things like sexual history and drug use. And so practicing this during both the didactic and clinical year phases of PA school can allow for these skills to really flourish and have tremendous impact on the outcome of these veterans' care. Additionally, this meets ARC-PA standards A.11, B2.06a, and B2.06f. And so in addition to allowing us to train these PAs to take great care of our nation's heroes, it also allows PA programs to remain in compliance with ARC-PA standards. So standard A1.11 states that the sponsoring institution must demonstrate its commitment to student, faculty, and staff diversity, equity, and inclusion through supporting the program through plans for diversity, equity, and inclusion, implementing recruitment strategies, implementing retention strategies, and making available resources that promote diversity and equity and inclusion. And so including things related to TIC and PCC as they relate to veteran care helps to meet this standard.
In addition, anytime veterans are included in your curriculum, you are also helping to meet standard A111. And this actually was noted specifically in the PAEA DEI toolkit, where they note that beyond race, ethnicity, and gender, military affiliation is yet another way in which to define diversity. So sometimes this is under-recognized, and the fact that the PAEA has placed this in front and center in its DEI toolkit is a reminder about the importance of including veterans. And we remember, of course, that the PA profession started with a group of hospital corpsmen who returned from combat in Vietnam, and the program was started under the vision of Dr. Eugene Stead. And it is interesting that even while the first PA students were hospital corpsmen, that the number of applicants with a military affiliation has been in a slight but ongoing decline. For instance, it was 3.6 in the 2012 to 2013 application cycle, and then it had moved down to 3% in the year 2018 to 2019. And so this brings us to another salient point about how veterans can help programs to meet the ARC-PA standards of the new ARC-PA compliance manual, specifically B2.06a, which was released in July of 2024. This new ARC-PA compliance manual is structured with focus questions and essential evidence. And so it's very helpful to know that by including veteran instruction, whether it be with standardized patients or the history taking of veterans, that can help to meet this essential evidence. For example, at the very bottom, it says the site visit team may request to review evidence of instruction, such as PowerPoints or handouts, worksheets, or case studies. And at the close of our talk today, we will share some tangible resources that help address that last point. Moving upwards, I do want to also mention that of note, the disability status can include disabilities, whether they be physical or mental, emotional, or learning disabilities. And because there are a number of veterans that do happen to have a disability, veterans with disabilities also would help to meet the standard if they are incorporated into the curriculum. In addition to that, the next point talks about special healthcare needs, and those special healthcare needs It mentions cultural. The unique needs of veterans have been described as being a special culture of their own, where veterans are at the center of care or veteran-centric. And so in explaining those special needs, as we have described here, which need a trauma-informed care approach, as an example, could help with that documentation that's needed. And then also, additionally, in that July 2024 new ARC PA compliance manual that includes standard BT B2.06F, which includes the curriculum that must include instruction to prepare students to provide medical care to patients with consideration for social determinants of health. We shared earlier about the large number of veterans who also meet social determinants of health. Therefore, including veterans into didactic instruction helps to meet this standard. And so having that documentation in one's curriculum helps meet the essential evidence, which is noted below again, where a site team may request to review evidence of that instruction. And then we also want to mention some key take-home messages and resources for PA educators and clinicians, as we all are very busy in terms of takeaways. We're pleased to share with you that there is a very VA-focused medical educator training, which includes free CME, and that is available at the the vha.train.org website. And then in addition, there are pocket cards that focus on military history, which Brandon will be discussing shortly, as well as public service announcements that could be readily incorporated into instruction. We have an example of such a public service announcement here, which could be easily folded in. And we encourage this, sometimes even incorporating small steps into one's instruction can be a great first step to take in terms of including veterans. And then another take-home resource for veterans is the resource MedEd portal, which is free and actually provides specific instructions on a workshop that was used for medical students to help them develop specific skills on veteran-centered care. We've already talked about the importance of patient-centered care for veterans, which really aligns with this. And this is based upon a documentary in 2011 that was directed by Heather Courtney. And she set out to follow the journey of childhood friends from her rural town. And she came across these gentlemen who all decided upon high school graduation to sign up as members of the National Guard. And she followed them for a few years and was even provided access to follow them when they were deployed overseas. So it's truly a unique perspective of both pre and post deployment pictures of the soldiers. And so the film itself, Where Soldiers Come From, is available in some downloads, but the workshop that was developed that includes segments from that film is available for medical educators. We also want to mention that another great resource for medical educators is the workshop that was offered in MedPortal in 2016 by Terragino et al. And that is patient-centered care. We've talked about how important that PCC care is for veterans. This also included families, and it really enables medical educators to choose a stepwise approach, whether it be 10 minutes of didactic instruction or a full hour of didactic instruction. This workshop is set up for medical educators to choose from what might be easiest for them. and it allows them to easily ramp up potentially if they would like.
And at the conclusion of this presentation, we'll have QR codes to some of these great resources. Additionally, there are some wonderful free resources available to both students, educators, and clinicians. So this comes from a website, haveyoueverserved.com. And these are some great questions to consider incorporating into your standard social history. Things like, have you ever served in the military? And if they screen yes, when did you serve? Which branch? What did you do while you're in the military? So you're getting at their job or their military occupation. Were you ever assigned to a hostile or combative environment? Did you ever experience enemy fire? And were you exposed to noise, chemical, or gases? When thinking around general health questions, this comes from the VA. This is already included in a lot of our standard education. So regardless of whichever acronym your program is using, if it's old CARTS or chloride PAC, we're already encompassing these portions. But what I want to highlight here are the military-related questions. And so what I really like about this script is that it's inviting the patient to give the consent to have dialogue here. Would it be okay with you if I talked about your military experience? And then if they screen yes, when and where did you serve? In what branch? And what did you do for work? And then here on the right side of the screen, you see some probing questions. And so when they answer yes, they may not be so forthcoming with that information. The idea is if you've built a good relationship with the patient and they feel comfortable sharing this information with you, things like, can you tell me more? Were you ever ill when you served? Were you or anyone you know wounded or injured? And we're not just talking about combat injuries, because injuries also happen during training, which are actually more common. Did you have a head injury? Were you deployed overseas? Did you see combat? And were you a prisoner of war? Additionally, this is a military health pocket card for healthcare trainees, and this is related specifically to exposure concerns, and so targeting that PACT Act that I talked about. And so when you ask about, would it be okay if I asked you about your environmental factors? So things that we're thinking about here are chemical, which could be pollution, solvents, or weapons. You can see this biologic with things like infectious disease or weapons, psychological trauma or abuse, certainly a whole host of physical injury. And you want to take into account what precautions were taken, how long were you there, in terms of how long were you exposed, and when were you exposed. So documenting those things can help to streamline. So these are just some examples of resources that already exist and that you can certainly tap into in your educational curriculum. Lastly, I just want to highlight a little off topic here, but if each of you could just hit pause for right now and save this critical resource in your phone. So this is a free and confidential resource for veterans. And unfortunately, as we mentioned earlier in this talk, more than 20 veterans a day take their own life. And suicide is the leading cause of death for veterans under 45. And this critical free resource could help to save a life. And it's important to note here, it's confidential, it's free, and you don't need to be enrolled in VA benefits in order to utilize this resource. Additionally, you'll note at the top there's a number that you can text. And so these are either phone calls or texts with somebody who's standing by 24 hours a day, trained and able to intervene.
And then finally, we did want to share with you some QR codes for those two workshops on MedPortal that I had mentioned earlier. This can make it a little simpler potentially to plan incorporation inclusion of veterans in one's curriculum. And there is also a third workshop here as well that talks specifically about a trauma-informed approach for veterans and others. So we encourage you to take a look at these to see if these may be of interest. And note that some of the lessons that we have shared do translate over to other populations as well. And so we think that this can be helpful in many regards for many patients.
So here are the references that we use for this evidence-based talk, and these are available for download if you'd like to continue your studies on this. And then lastly, we'd love to hear from you. So our email addresses are here. We'd love to hear about any innovative ideas that you've had with incorporating some of this content, as well as just continue to brainstorm. How can we as a profession best arm our PA students to go out and treat these veterans? And with that, we thank you for your time.
Thank you.